Good afternoon, everyone. It's Pete here, back with you from the Pain School here in Austria, and with a nice young lady called Claudia Petroni from Italy, who has come to attend the Pain School. Good afternoon to you, Claudia.
Good afternoon, Pete.
Claudia, and we met at another school up in the northern part of Austria in January, and when I saw her yesterday, I thought, oh, I know that woman, and she recognised me, and etc. But it's good to see you again. Tell me, I know you're in Austria to learn about the pain management, but you live in and practice in
Italy, in the north of Italy.
And whereabouts is that?
It's in South Tyrol,
Yeah.
which before had been a part of Austria. So we talk in Italian and also in German.
Okay.
We have a German dialect, and it's very interesting also because you have the different cultures.
Okay.
So
Tell me, are you a general practitioner, or are you a pain anaesthesiologist?
yes, I'm a general practitioner, and I work with 3 other colleagues, and we are sharing how to say, a studio. Yes.
Okay, the practice, sharing a practice, yeah.
Yes.
And can you tell me, how many patients do you see? Do you see many patients with pain?
Yes, a lot of patients. I would say maybe on one day, when I work a full day, we see at least 20 or even 30 people with pain. Yes, there are a lot of people.
And on average, you would see?
On average, how many patients? If it's a very busy day, then we will see maybe 60, 70. This and headache.
Yeah.
Yes, those
And
two. And also problems with the digestion, so also stomach ache,
Yeah.
and those 3 things, I would say.
So when you see the patients, do you is it just medication you give them, or do you provide self-management skills?
Yeah, for example, actually, I always try to give them some homework to do.
Good.
Because I
Excellent.
think it's very important.
Good.
For example,
Good.
for the people with stomach ache who have a gastritis, very often it's their major problem is the stress. They have too much stress, or either at home with their families, but especially at work.
Yeah.
So they have to change something there. They have to change also with their eating behavior, and most of them are also willing to do something, but there are some patients who don't want to do anything. They just want to take a pill, and then it gets difficult.
Oh, yeah. And as I know from my own experience from many years ago, just taking medication is not the answer. I think people with pain, we need to be active in have to be active in our self-management program.
It's absolutely necessary, I think so.
Yeah.
It's really important. And then they are also much more content when they do that,
Yeah.
because they see, oh, I did something myself.
Yeah. Yeah.
Then they come back and they tell me, I did this, and you were right, or I discovered that this is good for me, and that's very good, because then it's a good base to work with them.
What have you thought to the pain school so far? Have you learned some good information?
Yes, for me it was very good.
Yeah.
And I would need more time also at home to study, but
Yeah.
I have a schedule, so step by step I will repeat, and now it's very good. And also getting to know other people and sharing a little bit how they are doing it. That's good.
One last final question. How do you see pain self-management? Do you think it's be more established as the years go on? Do you think at the moment self-management of pain seems to be like a very distant cousin to pain management? Do you see that be more where the patient is more involved in the management of their pain?
I think that is absolutely necessary, because the health costs are exploding so much.
Yeah.
So people have to do
Yeah.
themselves more.
Yeah.
For example, they made a research, I have to tell you, where they saw that, for example, at a certain age, when you're 50 years old, more or less everybody has the same vertebral column
Yeah.
with similar problems, but there are some people who have pain and others who don't have pain, and those who don't have pain, very often the people who are more active. So it's very important.
Keep
And
active.
I try to be a good example and
You-
do
you
a lot
ex-
of sport.
Do you exercise every day?
I try. Yeah, with the children it's not so
Yeah,
easy,
yeah.
but I try. I try to avoid taking the elevator, and I take
taking the stairs.
stairs and things like that. And I do almost all my home visits to the patients
Yeah.
with my bicycle. So it's very
Wow.
good. Yeah.
Oh,
so I
you're
do,
very
I do a
fit.
lot of kilometers.
Message there for I know
Doctors, thank you.
doctors in the UK and other around the world that to do. So we didn't mean to distract Rudy. Just put a bit Rudy on camera. Just say hello, Rudy.
Yeah.
Dr. Rudy just
Yes.
arrived. I'd say that's fantastic, and I think you're a good role model. And there's a couple of GPs in the UK. I know Dr. Tim and Dr. Ollie. They are fantastic, and Dr. Francis. The way they promote self-management to their patients. So you are in their same orbit as them.
Well, thank you. That's a compliment.
Claudia, it's been fantastic interview, and it's really nice to meet you again. And I know we're going to keep in contact
Yes.
over the coming weeks and months. Thank you very
Of
much.
course. Thank you, Pete. It was a pleasure.